push down and away. But you want to get a rock first. A lot of people do the rocking from here. Rocking doesn't come from the upper hand. It's kind of assisted by it. It comes from the lower hand. So this is a nice, just gentle rocking. And you can do this with, say, every third, but I personally like to go pretty much every one. And again, you can let that body come back a little bit and then push into it. That's okay. If you wanted to, you could do the other side like that, or you could stay here.
But then aren't you pushing towards the spine and not away from it?
Yeah, but you're really trying to knead the muscles on the outside. So I'm just giving options. You could totally go around and do the same thing. Or if you wanted to keep the rhythm and not break the rhythm up to change positions, then you could stay here and absolutely roll into the spine or knead into the spine. Because you're really just kneading the ILS anyway, so that's really what I want to do.
Okay.
Good
Use
question.
rolling technique over the entire back again.
So I can do any rolling technique this time. Could use standard rolling, forearm rolling, and interlace rolling. I'm going right there. Pressure?
Maybe a little more.
Okay.
Press and knead BL23 in the lower back with fists. Using your body weight, apply more pressure during client's exhale.
So, again, to find this natural curve here, that's going to be bladder 23. Take a nice big deep breath in, and on his exhale, I'm going to go forward.
Oh, that's gonna feel
I'm
so
going to go to
good.
level 1. Nice big deep breath in after I hold for 2 or 3 seconds. Now I'm going to level 2. Hold and then breathe out and in one more time.
So are you still applying pressure while he's...
Slight, but not a lot. Kind of resetting.
So you back off then?
Yeah.
What level are you now?
Now we're in all the way. And then you can just resume regular breathing. And as I come out, what I need.
Press the points SI9 and SI11 with your thumbs. Back of the armpit in the middle of the scalp.
Ooh.
So SI11 we have. SI9 is up into the armpit a little bit, just underneath on the teres minor. Is that too much?
It's a lot.
Steps 22 through 30 should be done at one side at a time. When one arm is finished, go back to do the other. Rotate the arm in both directions. Cradle their arm and your forearm and rotate it. Stand behind the client. Your superior hand is on their shoulder. Your inferior arm, the medial side, supports their forearm. Apply pressure at shoulder joint as you rotate the arm.
That's the one that we did.
That's good.
So what I'm doing here is just counteracting my pressure with the shoulder joint. As I'm going forward, I'm rotating back and getting a little external rotation here at the humerus, and also finding any trigger points in the shoulder joint itself and adhesions that might need to get worked out.
Oh, yeah, you're working them out all right. Oh boy. That's...
Now you wouldn't need to go this deep, but if it might be indicated. and or your client might like it. In this case, indicated, and a little bit of the latter. Just won't say it. Okay, here we go. Next.
Grasp and knead the shoulder joint. Kneel in front of client, rest their hand or
Remember
forearm
this?
on your shoulder. Yep. Then roll the arm. Shake the arm and wrist. Shake arm by grasping the wrist and pulling the arm tightly, and shake gently a small, quick movement.
Shaking done with the thumbs right at the articulation of the carpals and the ulnar radius. Fingers underneath, flip. It's not coming from pushing forward. It's going to look like it is, but it's coming from the flip. Shaking.
Knead and press the palms. Work on the palm, especially PC7.
Hold on.
Oh,
You could also do shaking with the ulnar side, or the peel the palm in the articulation back and forth.
Fish.
Okay. Okay, kneading palm.
especially PC7 and PC8.
So, my pinky
Oh, this one.
and
Yeah.
ring here. So my pinky's gonna go between ring finger and middle finger. My ring finger's outside of his pinky side, and then I can do the same thing over here.
This is it right here. This is like heaven.
And then knead. I got a good stretch. Counterpoint on the back with my fingers as I knead.
The light's even golden on this portion. Oh.
Yeah, dude. I'm like drooling a little bit.
And then he said, pay attention, or she said, pay attention to PC7. That's right here in the middle of the wrist at the articulation.
And what does it do?
Great for carpal tunnel. You could also knead the hand like this. Same thing. Not uncomfortable for most. If they can't access this position, and some will not be able to get this access because of some tight other places, that's fine. Then go to this. And then here you can really get PC7. Okay.
Hold, twist the fingers. Do a mini variation of rub rolling on the fingers, front and back sides. Work fifth finger to thumb. Is that what we just learned? Okay.
Yes.
And then snapping.
Oh, I didn't realize how little amount of pressure you're applying with that. Is that?
Hard pressure is going to be hard to go fast.
Oh, okay. That's why I was going so slow.
Hard pressure is going to be
Right.
really slow. So light pressure, just enough to roll
Sure.
the phalanges.
Sure.
Rolling technique on the arm, both medial and lateral sides, grasp at wrist.
Press right above the wrist, kind of at it, but I'm right above the ulnar radius where they meet. And then what I'll do is I can get the lateral bicep and delt, rear delt of the arm, and then I want to keep a 45-degree angle. I just moved for the camera there. Then you can just change and go medial bicep, and front delt. Rolling.
Loose on the arm. Gently stroke up the medial side toward the heart and down the lateral side
Loose.
with the fingers.
Loosoon.
Loosen.
Loosoon. Up the medial, down the lateral, always. Nice light. Just think of the energy. You're applying good energy, drawing bad. Taking away the bad.
And then ditto on the other arm. Everything else.
Okay, we're gonna skip the other arm.
Use padding techniques on the whole back. Chopping, cupping, striking, chopping again.
Okay, so chopping is this. Okay. Next.
Calm patient down.
No, next.
Oh, cupping. Sorry.
Cupping. Slight cup here. Okay. So put a Kleenex in the middle. Hold the Kleenex with your palm. Seal it up with your thumb. Loose wrists. Every time
Like
you're
a
gonna
goose.
every time you're gonna do any kind of deportment or percussion, I pretend like my wrist is tied with a string, and I'm a puppet marionette, and it's pulling me up, and then as I drop, everything comes from that, instead of trying to do it from the elbow or from the shoulder.
Striking.
Striking. I guess chopping isn't this. Let me think for a second. Chopping. Oh, striking. No, it's knocking.
Striking ball.
This is striking. Chopping. To think about that for a second. So we have chopping,
What's this one?
striking. Here you go.
Chickens.
Striking. So all you do is take your fingers, put the tips together, close it off with the thumb. Got to have the bend in all of them so the tips come together. Not trying to get them like that. I want to get them together. Okay, and then we're just pecking exactly.
Woody woodpecker.
You can get really, really precise with your pecking, and a lot of acupressure points. With your striking. Okay.
And then chopping.
There
again.
should be knocking. Okay, knocking is finger inside of the palm. Wrap the fingers around it. Place the thumb on top so there's no air getting out. Gently release the finger, and that cavity is now your knocking hole. Makes this sound. It's a hollow sound. So you can hear it a lot more on the skin.
Nice slabs. I like those slabs.
And that's just everywhere, like, it's not gonna hurt them anyway.
You want to be light around the kidneys. Down here. And Dr. Joe will always go right over the spine, really hard with the cup. And then what?
And then calming the patient down.
First you're gonna sweep, so come up slightly and sweep down. Not hard, sweep. Just hitting the shirt. And now I'll probably go back to GB20. GB20. And calm the client. That's how I calm the client. You could also calm the client by sending G.